Welcome to the Healthcare Planning and Infrastructure Expo Conference 2025.
We present our first panel discussion, Strengthening Standards for Patient Safety, Clinical Outcomes and Organizational Resilience. The moderator of this session will be Dr. Narin Sehgal, Medical Director and Head, Minimal Access Pediatric and General Surgery. Dr. K Rana, Founder and CEO, QAI. Dr. Zakir Hussain, Managing Director, AeonMed Equipments. Colonel Rakesh Verma, Founder and CEO, AeonMed Hospitals Private Limited. Join me in welcoming all the panelists on the stage with a big round of applause. Now we are starting the panel.
Good morning, everyone. It's nice to be beginning a session because I find that most of the people, they are awake, they are inquisitive, enthusiastic, and would definitely grasp and take home the messages which we are able to give to them. And I hope this is a good session with good interaction. We are going to discuss today on strengthening standards for patient safety, clinical outcomes, and organizational resilience. We have gathered here at a time when healthcare systems across the globe are rethinking how we deliver care, not just safely, but sustainably and equitably. Patient safety is no longer a checklist, it's a culture. Clinical outcomes go hand in hand with system design, and resilience is not just about bouncing back, but bouncing forward. What we are going to explore today is how we design hospitals for resilience, how we measure matters through safety metrics and KPIs, and how accreditation and audits can drive excellence. And finally, what pandemic learnings must be institutionalized. Today, I have with me a great panel. They are all dons in their own field. We have Dr. Upasana Arora. Everybody knows her, and I think she has been doing wonders in healthcare for last so many years. And very soon, she is going to announce a beginning of a very big super specialty hospital, which, dazzling buildings that I can see. I'm very sure what all good things would be there in that institute. I welcome Dr. Upasana Arora. Can we give her up a big applause? We have with us today Mr. Zakir Hussain, who's the director of AeonMed Equipments Private Limited, a visionary leader and a true innovator. He's dedicated his career to revolutionizing healthcare infrastructure with a primary focus on airborne infection control. He is recognized through a grant of patent for his invention titled System for Conditioning and Sterilizing Air. He is the driving force behind several cutting-edge technologies, including the ductless air handling unit, laminar flow systems, ozone generator, and air filtration and circulation unit. A warm welcome to Mr. Zakir Hussain. Dr. Rana, who doesn't know him? I think he charted the path on which we are traveling today as the CEO of NABH. And after having done that stint, he was bold enough to start his own organization, QAI, or Quality Accreditation Institute. He has held a lot of positions nationally and internationally, and his expertise over 25 years in standardization, quality and accreditation is truly unparalleled. He is known to do different things differently, and a man who dared to venture into creating QAI, as I told you. This is the first private healthcare and laboratory accreditation body with international recognitions, and making it second AB with ISQA, EEA organizational accreditation, and ILAC, MRA in healthcare and laboratory accreditation space respectively. Let's give him a big hand. And we also have Dr. Colonel Rakesh Verma with us. He at the moment is CEO of AeonMed Health and Hospitals, a consulting company specializing in hospital planning and design, hospital and healthcare quality and accreditation, hospital operations, learning and simulation systems for healthcare and risk management of healthcare, the need of the hour. And imagine, after having spent in 28 years in AFMC and AIMS, he came out and thought of such a venture, and the amount of work which he's doing. And I was speaking to him, and the initiative which he has taken and innovation, which I am sure we would like to hear when we are talking on the panel from him, I expect will do wonders for quality, which he is going to provide as a QAS, quality for service, as a service. So welcome, Dr. Rakesh. So let me start this. They've already given that.
Dr. Narin is here, who is running a hospital, very successful hospital. And same time, he is involved in many quality initiatives. And there was a very big and very successful conference by the name of KAHO. He was main person who has done lots of work. He is working with NABH, he is working with the AHPI. And he is a big name for quality and patient safety. And the best part is his hospital is ABDM compliant also. The big round of applause for Dr. Narin Sehgal.
These impact quality. See, when we look at the quality in the hospital from the infrastructure perspective, we are talking about quality of the structure. But we have to design and build for quality, something that can deliver quality. You might have a beautifully constructed building, but if it does not support the healthcare processes, it is not going to work. If you design a beautiful building, a modular operation theatre, but if it has a toilet on the above floor, just above the OT, that design is flawed. You may have invested 50 lakh rupees in the operation theatre. So therefore, the requirement is to design for quality rather than looking at design of quality. So when we say we have got a beautifully constructed building, we've got innovative materials, we've got everything that money can buy, the design is a function that matters the most. If it is not designed well, it's not going to work. It's like having a plumbing system, and I have done this in hospitals. You have a faulty plumbing, you might put a Kohler fittings on that. It's not going to work. Your OTs will always have infections. Why? Because the plumbing is faulty, not the fittings. So when we look at infrastructure, most of us are enamored by what looks, but unfortunately, the design aspect does not get covered. And this is where the standards come in. Now we have no design standards for hospitals. So when we design hospitals, we'll go by National Building Code, which essentially talks about safety, usability, and many other requirements. We go by National Electrical Code, which talks about electrical safety and things which are relevant. We have various things. But even today, when I have to design a hospital from a pure design point of view, there are no norms. So I think there is a need to have a design standards. We do not have design standards as of now. There are textbooks which talk about hospital design, but they talk about designing a OT, ICU, dialysis unit, things like that. But what are the design standards that we do not have as of now? I think there is a need to have design standards. The other part where the standards are necessary are things that are related to processes. Now your infrastructure design is going to fundamentally impact the processes that we have in the hospital. So if our processes do not work in a manner in which they are supposed to work, whatever we may design is not going to work. So we have to have a design and the processes together. And there are standards for processes. So you have the standard operating procedures that the hospitals built. You have the accreditation standards that demand a certain process to be in place. So these standards help in delivering safety. They help in delivering quality. There is one aspect of resilience that Dr. Narin has pointed out. Infrastructure resilience is something which cannot be retrofitted, or I should say it like this, which is expensive to retrofit. If you have a building which is not resilient from the infrastructure point of view, it is expensive to retrofit that building. Remember when the seismic codes or the seismic classification was revised, a lot of hospitals needed to be retrofitted for seismic safety requirements. This happened after the Bhuj earthquake. So retrofitting is something which is not very easy. It comes at a huge cost, and in many instances it may not be practically possible to really do it. What can be done in every place is the process resilience. And unfortunately, in the hospitals, when we look at resilience, we only see, okay, whether this building can withstand an earthquake, can it take wind load, can it take this, can it take that? That's the part we are interested. But process resilience, we are not able to handle. So the hospitals which are unable to invest or unable to provide for a resilient infrastructure can look at process resilience, where the processes try to cover the limitations of the design, limitations of the infrastructure, and this makes it resilient. I think these are few things that we can do very easily.
Upasana ji, I have two questions for you. You are involved with health with the government. What is happening in tier 2 and tier 3 cities? How the tier 2 and tier 3 cities build resilience with limited budgets? They have limited budgets, so how are they managing and what is expected of them?
So government actually now want to spread their wings with the help of private hospitals on PPP model, because they want that health should reach to each and everyone, and that is why this Ayushman Bharat scheme they have launched and successfully run, especially in small cities, tier 3, tier 2. And there was a question, I think FICCI and CII both are now raising with government. They have stopped taking this refurbished items. They said, no, we will not accept refurbished items. Problem with tier 2 and tier 3, if they want to give services for for an example, robotic surgery, they cannot, a small hospital cannot afford 15 crores in one go, and with lots of other things are also involved, so it will reach around 18 to 20 crores rupees, so they cannot spend. So if we can get such kind of flexibility in India, so we have already raised this question to government ki we want to provide everything to small cities, but for that we need to have, there is a question I think. Yes, please.
Robotic surgery is just mentioned. So robotic surgery means probably the cardiac part, the cancer treatments, all those things which involve huge investments and
There are many other schemes state-wise. Every state has their own scheme. And now they are inviting, like I have received a call from Agartala that they want us to make a hospital there. So all states wants to give their citizens best healthcare and in an affordable price. So for that, what to do? This is again a problem. If because Dr. Narin and Dr. Rana, everybody can vouch for me that quality comes with some cost also. So we need to, define again our system where we can provide best healthcare at affordable price. I never use word cheap. We are not cheap like other. There was a time everybody was talking about India is the best destination for medical value travel because it's cheap. Why we are cheap? We are the best in all form. Doctors are good, technology is good. We are providing best thing. Yes, affordability because everybody cannot afford, and this is a big challenge for those who are middle class families who are not saving anything because they don't have. The answer is only one: insurance. And now it's high time we should take insurance companies in loop that everybody has to covered under some insurance because this Ayushman is below poverty line people, or now it's again a very good decision that plus 70 years can enroll in Ayushman Bharat.
So that's why I'm requesting. Dr. Rana, from a quality and safety lens, how do you see infrastructure supporting patient safety? Are we designing with risk mitigation in mind?
Thank you, Doctor, for this question. Very difficult question, actually. Because if I say the reality, the many.
See, I'll put it like this: with the infrastructure that you are seeing now, you think have we designed with mitigation, risk mitigation in mind?
Okay, thank you. I think the way awareness is being created through the events like this and many more like this, things are changing. Still, I have seen personally a couple of hospitals well designed, like they are the 5-star facility. And when I come out of their ICU or operation theater, I see a ward inside, just in front of that. I walk into the CSSD, I walk the same route, I come back on the same route. So I think there are challenges, and maybe those challenges is because they may not have access or knowledge of who can design their infrastructure better or as per requirement. So when we talk about patient safety, yes, is obviously the infrastructure, the building, which can pose serious risk to the patients in times of either any structural things like tsunami, earthquake, or any other things, and also the clinical safety. Clinical safety is not just restricted to the doctors or nurses' interventions, but it also comes from devices, medical devices. It also comes from infrastructure like how the air is cleaned and how the air is made sterile to come into the areas which are required to be done. So I think these are the aspects which really play a very important role. And then as a healthcare provider, if they're starting with a new venture, new structure, I think they should be considering the right person or the right institution to give you the structural design. And if you're already in build there, and then I think you can have another access to see how they can retrofitting when it comes out the retrofitting, we talk about if they can be making it some modification, amendment, changes to make it better. And I think that's the key for delivering the quality care. And I agree what Dr. Upasana mentioned is we are not cheap. We are best in clinical care. We are best in pricing. Put it that way, because we have good infrastructure, we have good clinical processes, we have a good system in place through accreditation programs to deliver the high quality and safe care to patients. So I think that makes life easier for one, but creating an awareness on an ongoing basis is important for having the good design to deliver the good quality and safe care to the patients.
Thank you so much. I have just been told we have only 5 minutes left. So Zakir Hussain ji, you are into innovation and technology development, especially into air conditioning and air quality. Tell us, how does technology help in building resilient hospitals and help control the biggest threat to the healthcare, that is infection? Please.
So right now the technology what we are using for the air conditioning in a hospital.
Pass mein rakhiye sir.
So what we are using right now, the technology for the air conditioning is the ducted systems, because and the ducted system AHU, but the duct is one of the main source of infection. So we had developed the ductless system, because duct with that ductless systems, it will be easy for the making the infection control in hospitals, and we can give the better air quality with the systems, because these systems having the less operative maintenance cost, and the further thing is that it will give the 10 times better air quality, because this is not just giving the filtered air, but this also having the UVC also incorporated in that. So it will kill the microorganisms and filter the microorganisms. Both the things can be done. So this is the one of the way to make the better air quality in the hospital, and this can be given, and means every room can be given the different AHU, and it will be right from the sizes of the room. It's available from the 1 ton up to the 11 tons. So it can be catered according to the requirements of the hospitals. And apart from that, the system what we had developed is having the auto cleanable filters, so maintenance free systems. Then the life of the system should be AHU will not get the rust free for the lifetime. That also we use the material according to that. And just not giving the normal filters, but which also having the activated carbon filter, so it will control the VOC. VOC is one of the main problems in the hospital. So for the controlling the VOC, we had done the three things in that. We had given the negative ionizers, we had given the activated carbon filters, we had given the UVC, which will also minimize the microorganisms. So that way it will also minimizing the VOC in the room. So that is also done by the systems.
Thank you so much. I know I am overstepping my time limit, but I think the time was really halved. So it's all right. Just 2 questions now. One is for Dr. Rana, very, very important in present context. Smaller hospitals see accreditation as costly or cumbersome. How can we simplify this journey for them without compromising on standards?
Thank you. I think very important question. And I think this is a myth. I say whether it's a small or big hospital, the cost of quality is not there. Obviously, as Dr. Vashna mentioned, quality cost. But you also should know the poor quality cost more. And the quality is seen as like something which is external to the environment. It's not taken as an ingredient of the healthcare delivery system itself. It's like you have a surgery, a medicine, quality is another department. I wonder, I challenge, when you construct a hospital, do you also keep a room for a quality? Is a quality department like you have surgery, medicine, OPD? Do you have that department existing in the beginning when you are creating it? So I think it's a myth. It's again the environment, the awareness, the knowledge, the information to smaller hospitals not available. They are being just by some of the organizations and people, they drive, no, it's very costly if you put this standard, that standard, you have to break this. No, something can be done within the existing infrastructure, like we mentioned about the operation theaters and ICUs and all these things with minimal changes, with good output. So I think quality is making you better, making you more resilient, to make the things happy, effective and efficient. So I think that's the message which we're sending across. Please send those hospitals to us. We will make their life easy. We have the standards developed for those types of clients which are smaller, not requiring much, but not compromising on the outcome of the clinical care as well. Thank you.
That's a great answer. Thank you so much, Dr. Rana. And one last question for Upasana ji. You have built such a large, huge and a fantastic hospital very, very recently. What were the challenges that you came across in terms of design, quality, and incorporating safety and holistic care? In short.
So actually my core area is patient safety. So I have designed my emergency with the architect that we have to save golden minutes, not hours. I am not talking about hours. So we have put all radiology there, ICU there, and we have put one lift to the OT and cath lab. So it was our, somebody who knows quality has to involve from the beginning of architecture. So we have made this hospital with all the vision, and we have made one what do you say, that for air ambulance, we have made helipad also. So we can save that time also when patient is coming from, somebody who is sick, coming from air ambulance, then on road he is coming to the hospital. So we try to save all those timings for patient, because I know golden hours and golden minutes are very important for fully recovery. And lots of things, because I am into NABH. When Dr. Rana was there, from that time I am with NABH. So I have learned all the chapters, you must be aware. So we have put all those things in form of, Dr. Rana was telling us CSSD, there is one way only. So we have made accordingly. I have put all my brain there to make my hospital patient friendly as well as patient related to patient safety.
So it clears us beautifully that healthcare is a teamwork. You cannot work in silos, as she very rightly said. Everyone has to get together, give inputs, and come out with a design. And I think we need more specialists like Dr. Verma, who, after having gained so much of knowledge, they are doing specifically guiding us into what needs to be done. We had a lot of questions, but I am sorry, the time is up. Thank you so much. It was, you want to make one comment, Dr. Zakir Hussain wants.
See, now getting the better air quality, air conditioning is one part, but apart from that, every department, every places have the different requirement. Say for the isolation ward, you require the negative pressure systems. For the burns ward, having required the different systems. If you go for the tuberculosis ward, there is the different systems is required, because the infection is spreading. Even the doctors who's treating the tuberculosis patients, they also get the MDR positive. So at that time, you have to give the different system like that. Every bed that infection can be picked up and safely taken out. And at the same time, whatever the air is coming inside the room, that also has to be filtered, and from air conditioned air has to come. So we had designed a different system for the different area. And some hospitals said that already we have the air conditions already put it. How we can give the air changes in that? See, WHO and CDC guideline is that minimum 12 air changes has to be there in a ICU and the NICU. But most of the hospital, if you go, they are put it, there's a simple systems like putting the cassette AC or giving the split AC, they are operating their ICUs. That in that way, they are not doing any air changes. And the biological burden go on increasing in that particular area. So in such an area, we had developed the AFC, air filtration and circulation system, where you will get the air changes also, and the positive pressure also. So that can be also done. So we have the different models for the different area, so that according to the need of the hospital or particular wards, we can give the different solution for that. So that we had already developed. And my stall is also here. One can come and meet and see the systems what we had given.
Thank you so much, Afzal ji. Thank you all these speakers. I think it was a pleasure listening and learning from you. Thank you, Afzal ji, for organizing this conference and having allowed us for this great session, and all the delegates who have very patiently listened to us. I'm sure there would be a lot of questions, but please, those can be put when we are out for tea. Thank you so much.
Sharing insights on enhancing healthcare standards for a safer and more resilient future. May I now request Mr. Afzal Kamal to felicitate the panel. Our first panelist, Dr. Upasana Arora, Director, Yashoda, Medicity. Dr. K Rana, Founder and CEO, QAI. Dr. Narin Sehgal, Medical Director and Head, Minimal Access Pediatric and General Surgery. Colonel Rakesh Verma, Founder and CEO, AeonMed Hospitals Private Limited. Zakir Hussain, Managing Director, Almed Equipments. Now, I request all the panelists for a group photo.